Dr. Hamisi, karibu sana to K24 Alfajiri. We've had you here before, always a good time with you. But please, for the sake of those who are tuning in for the first time, just introduce yourself.
Thank you very much for inviting me to the show. And good morning, viewers. My name is Dr. Hamisi Kote Ali. I'm the CEO and founder of Premier Rehab and Wellness Centers, where we specialize with alternative methods of healing, or rather, alternative ways of preventing diseases.
Okay.
Right.
All right. And today we're talking about strengthening your nervous system. And, you know, I kind of feel like you're taking us back to the biology class, which is okay. We're not complaining. Let's start just by refreshing some of us and our viewers back at home. What exactly is the use of the nervous system? What is the function of the nervous system?
The nervous system, first of all, let me just define what nervous system is. The nervous system is the brain and the spinal cord, and the nerves that branch from the nervous system, from the spinal cord. That forms the central nervous system and the peripheral nervous system. This is the network or the mechanism by which the body communicates. And as we age or as we get older, the nervous system gets compromised by one thing or another. And for me to be able to discuss it well, I'd like to go back into the neurodevelopment, and maybe more so to start from breathing. And say that when...
All right, just to let our viewers know that we also have someone else who is in studio with us today. Of course, we have Dr. Hamisi, who's going to be taking us through the entire nervous system. And we also have Jacob. Good morning, Jacob. How are you?
Good morning.
Yes, please just introduce yourself and tell us who you are, what you do.
My name is Jacob Duati, a recovery exercise therapist at Premier Rehab and Wellness Center.
Okay. So exactly what are you going to be demonstrating to us today?
Today I'm going to demonstrate a very soft and relaxing exercise where we practice on the floor and we exercise the nervous system from the foundation, from the body plank itself.
Okay, so I just want us to understand the importance of exercising when it comes to the nervous system. What is the main importance of it?
The importance of exercising the nervous system is direct connection of your mind and body, where we rewire the body from the mind to the body to bring awareness of your mind and the movement of your body.
Okay, so is there a particular kind of way and like particular exercises that we are going to be focusing on for the sake of this segment today? Exactly.
There is the exact kind of exercise that we do perform, which are very gentle, relaxing, and direct lying on the floor, where we don't push, we let the body move with its own pace without forcing anything.
Okay, absolutely. And we shall be getting back to you shortly, Jacob. Asante sana.
Thank you.
We shall be joining Jacob on that other side shortly. But just kindly just continue with what you were explaining.
So for us to understand the importance of the nervous system, we have to go back to the neurodevelopment. And more specifically, I want to start from the 8th and 9th month. The 8th and 9th month is the time that the lungs fully mature. So when a child is born, during that delivery time, the first 5 minutes are tense moments for both the doctor, the mother, and the nurses. And why is that so? Because everyone is waiting for the child to produce that fast, loud cry. Why is this very important? And why do you see everybody panicking in that moment? It is because that fast breath kind of reignites our entry into the world and makes the child start exploring space around them, and also makes the nervous system, as we know it, to also start working independent of the mother. So when the child cries that fast cry, what happens is that you get a full lung expansion, and this is key to how you're going to live from that to the rest of your life. If you look at a child when they're young and when they've just been born, for the first few weeks, the child doesn't do much. But as the child starts, the first few weeks, the child will start experimenting by moving their arms, trying to move their neck. But if you watch those movements, they are all very subtle and gentle. Why is that so? It is so because at that time, the child is trying to, one, discover what is around them, and number two, trying to make a connection between the movement and the central nervous system. So it is with that foundation then that we start looking at the importance of how do we then maintain the strength of the nervous system from birth moving forward.
Exactly.
If you look at a child, as a child grows, you'll realize that the children are very inquisitive. They are very curious. They want to touch. They want to put things in their mouth. They want to keep on feeling.
To crawl.
Yes. But as we get to adulthood, then we subconsciously start losing that and focus on things that are not natural. Long sitting 8 hours from 8 to 5, engaging in different activities like even slouching on the phone that are not the normal ways of moving. And as a result, we start compromising breathing. And the next thing we compromise that follows the same is the nervous system. So what happens is that if you sit in an 8 to 5 job and you are gazing into a gadget, what happens is that you start slouching forward. And what that does is that it starts compressing your organs in the pelvic cavity, your organs in the lumbar cavity, and your organs in the chest cavity.
Exactly.
When you compress these organs, what you do is that you reduce what is called organ vital space. The organ vital space is crucial in our lives because it is this organ space that allows that particular organ to have a bathing area, an area where it's able to operate without restriction. So when you restrict this vital capacity, what happens is then the organ function becomes diminished. As a result, you start having dysfunctions, and as a result, the nervous system gets compromised.
Exactly. And
so
I also guess this is the reason why people acquire some certain postures, you know, as a result of how they've been sitting, how they've been, you know, how they sleep. You kind of get to see that your posture even changes with time, right?
That's right. And the next thing that happens, we start getting stiffer and we start getting rigid. And the more we get older, then we lose balance, we lose coordination, we get sickly because things within us, the connection between the breathing, the nervous system, and the entire body organs is interrupted.
All right.
So what we try to do then to make sure that we can enhance the human activity from that point to the entire time we are alive is to introduce ways that, one, we are able to maintain the breathing. Number two, we are able to consciously feel or understand each and every movement that our body performs in every segment. And by so doing, there are several things that you can do. Number one, you can get what you call spinal manipulation or spinal adjustment, whereby you visit a chiropractor and they analyze your spine and they are able to correct what we call spinal subluxation or tiny misalignment within the spinal column that cause pinching to the nervous system, preventing the nervous system from exploring its full potential. The next thing that we accompany that with is it's what we call the Feldenkrais Method. The Feldenkrais Method was developed by a man by the name Moshe Feldenkrais. Moshe Feldenkrais was a mechanical engineer born in 1904. And what happened to Moshe Feldenkrais is that he developed a knee injury. He was a martial art guy, and he developed a knee injury that necessitated him to have surgery. However, he wasn't the guy to go for surgery. He wanted a different alternative that was not surgical.
A different kind of treatment.
That's right.
Okay.
And him lying in his hospital bed, started experimenting various movement of his knee. And to his shock is that the exercises that he tried or the movement that he tried ended up relieving his pain and clearing his pain completely. And being a mechanical scientist, he started learning a lot about anatomy and learning about the human biomechanics. And with so he started developing the Feldenkrais Method, which he then again started teaching other people. So what is Feldenkrais Method? Feldenkrais Method is very subtle, it is very gentle, which involves regularized breathing or slow, gentle breathing and gentle movement. What do I mean? You can say, and this is not yoga and this is not Pilates. I
was just about to ask whether it's something close to yoga.
No, it's not yoga, it's not Pilates. This is an exercise that brings the body-brain connection.
All right.
So what you start by doing is initiating movement based on neurodevelopmental sequence of a child. So the first thing that we start learning when you're doing Feldenkrais is to be able to learn how to move, let's say, our hand, and then how to be able to coordinate the same with our neck. And as a result, we develop a conceptual pattern that makes what you feel in the brain and the particular movement connected. So if you move your neck, you're able to feel each and every bone or every vertebra. As you know, in the neck, we have 7 vertebrae.
Yeah.
You need to be able to feel each and every one of them as you do the exercises.
When you're moving your neck?
Yes.
Okay, when you're doing this particular exercise?
That's right.
All right. Okay, so how do they help? Like, for example, we've had this discussion before, and we've talked about the way sometimes even your walking might be affected by the fact that, you know, the things that you have been doing wrong that have affected your nervous system. And you kind of get to realize that one of your legs is longer than the other.
That's right.
So how do you correct that?
Now, that, as I said, you correct it through chiropractic adjustments,
All right.
some soft tissue work,
All right.
and the right integration of soft, subtle movements that, first of all, brings you into the awareness of your body. What happens is that if you see most of us who go to the gym, you go to the gym because your friend goes to the gym, and you go to the gym and you're like, okay, I want to start lifting that weight. But the first thing that you don't know, even you don't know how to breathe. And someone will be like, I know how to breathe, I breathe all the time.
And nobody really does teach you how to do that.
Exactly.
When you get to the gym, they just tell
Yes.
you, okay, now let's get started.
You cannot do a proper training that will not hurt yourself if you don't understand how to do breathing. Because we are supposed to be diaphragmatic breathers. What does that mean? You're supposed to, when you breathe, it's your belly that is supposed to come up and down. That is what is called diaphragmatic breathing. However, as I said, when you sit for long and you're in this position, you're compressing everything here. So we shift from being diaphragmatic breathers to apical breathers. Apical breathers means you breathe from here. And when you breathe from here, it is not sufficient, and you're exposing yourself to injuries. So the Feldenkrais method helps you to start, first of all, coming into aware, training your brain to be aware of how you breathe. You know, so the first thing is we start teaching you how to do diaphragmatic breathing, so that when you understand how to do diaphragmatic breathing, you are able, through the mental connect, through the brain connection, to relax muscles, ligaments that before you wouldn't be able to consciously. Yeah.
So I really want our viewers to understand the kind of disorders, and especially the chronic ones, that one can get as a result of not exercising your nervous system.
Oh, almost every pain you get.
Right.
Back pain, neck pain, constipation, acidity, depression. Anything that affects the human being has direct connection with the breathing. So, for example, you get a lot of people who get depression and anxiety. And these people, if you put them through a Feldenkrais class in an hour, you will be shocked by the transformation of the same person within 1 hour. Why? Because you tend to, when you're doing this breathing and subtle movements, you tend to get centered to yourself. You get to be aware of every single movement that you do. And as a result, your body gets to relax. Your muscles get to relax. Why? Because you are actually utilizing the entire you. The central nervous system is able to distribute its power, its communication evenly throughout the body. And as a result, you're able to relax. You're able to release a lot of chemicals that help your body to calm down and relax your muscles. And as a result, the pain goes away. The sense of feeling hopeless goes away. The depression goes away. And what is crazy is, if you try Feldenkrais and you have, let's say you have a very acute backache, and you lie down for 20, 30 minutes, and you start doing these subtle movements, you'll be surprised when you wake up, you have no pain.
Wow. And you know, like, the thing I really like about this segment is that we always bring people who give solutions, rather than just running to a doctor or going to get tablets over the counter. There are solutions, there are things that you can do even at home for you to solve your problem, right?
And that's right.
Exactly. So shortly we shall be just like looking at some of those exercises that we need to do to exercise our nervous system. But before we get there, I want us to talk about the diagnosis of the nervous system.
The diagnosis of the nervous system can be done in 3 ways.
Okay.
And we do it based on the 3 pillars of health. For you to say you're well, 3 pillars have to be synchronized, or they have to work together. Pillar number 1 is your structure. The structure is the frame, which is you head to toe and whatever is inside it. The second pillar is what we put in our mouth, whatever we eat, the fuel that drives this system to move. And thirdly, it's the emotional health. The emotional health, in this case, I try to use it as the lubrication that lubricates this system to be able to work properly. So the first thing that we do is assess through various medical and physical exams, the structure, and be able to use some of the machines to see what is the body alignment. Is your body crooked on one side? How is your posture? Number 1. Number 2, we want to understand what foods, what do you eat mostly? Is your body acidic, or is it balanced between acidic and alkaline? Because that is key, again, to how the body signals. And the third thing is emotional health. We want to understand, how do you deal with your emotional tension? What do you do to relieve your emotional tension? And most of the time when you ask people what they do, they don't do anything. They just bulldoze through it.
Exactly.
So once we have analyzed each one of these 3 pillars, then we are able to come up with what we call as a report of finding. Okay, and this report of finding, then we use this report of finding to be able to educate the client or the patient on things they need to do or things they need to change so that their body changes. What most people don't realize is that when you go to the doctor only has a 0.0 something % help of yourself. The rest of the help, it's all up to you.
Wow.
And for you understanding that, it's key to how you enjoy life. It's key to how you live pain-free. It's key to how you avoid diseases. And that's why just picking a pill and swallowing and getting a short-term relief doesn't work.
Yes. It doesn't solve the problem that you have.
Yes, it doesn't work.
Okay.
But if you understand the various things you can do, for example, it's important that as we get older, we eat more fruits and vegetables. We eat more green stuff and some protein, and cut on our carbohydrates, because you don't need a lot of sugar when you're older, because you don't need a lot of energy when you're older.
Yeah, exactly.
You need more body repair.
Yes.
Okay?
Yeah.
And if on the other hand you're forced to eat all these acidic foods, and you're eating a lot of bread and people getting all this gluten intolerance, you start messing what is called the microbiome. Microbiome, it's the internal environment within our gut, and this microbiome serves as a supercomputer because it is what communicates between the brain and the gut. Anything that falls within the brain, the first place of interpretation goes to the central nervous system through what we call the enteric system. And that connection has to be maintained by a balance of the acidity and the alkalinity, and by the rigidity or the flexibility of the surrounding muscles and the surrounding bones and ligaments that house the gut.
Wow.
And now, then the emotional connection of this have to work together. So it's in this holistic look that gives us health.
Amazing. And is this so amazing how, you know, everything that we eat is more or less connected to our health?
That's right.
Amazing.